Hi, good afternoon, everyone. I'm from SGH community. There's Nadia here. Can I know whether everyone can hear me very clearly? Very clear. Oh, nice. Thank you, Miss Christina. So how's everyone doing? Good? Had your lunch? I see quite a few in the activity center, is it?
Yeah.
Some is at home. Okay, nice. So today the topic will be I'll be sharing with you on our chronic disease series of cholesterol and the heart. Yeah, so are you guys ready? Can we start?
Yeah.
All right. So basically the content that I'll be sharing with you today will be about cholesterol and what is high blood cholesterol, the causes, the risk factors, signs and symptoms, its complication, treatment available, and self-care. All right. So what is cholesterol? Can I know on the ground, anybody know what is cholesterol exactly or roughly know what is cholesterol? Anyone to unmute themselves or type in the chat box?
Put the fatty tissue in the liver.
Do I have it on my screen though? Okay, that's good. Anybody else? Fatty tissue in the liver. Okay. Anyone else want to give it a try? You can unmute yourself or you can type in the chat box. Okay, so you are not wrong, which is a good answer. So basically cholesterol is a waxy fat-like substance. So the body need it to build up cells and vitamins is found in the cell walls of your body. But cholesterol, if it's too much, then it's not good for your body. So I will explain to you in depth in the later on slides what exactly is cholesterol. Okay. So where does cholesterol come from actually? So it comes from two sources, mainly from the food that we take in and from our liver. So the liver makes all the cholesterol that you need. So it processes the cholesterol and it also make the cholesterol. So the remainder of the cholesterol from your body is from the food that we eat, mainly from the dietary product or from animals. So too much of certain food actually may result in buildup of bad cholesterol. That's why it's very important for us to know what is cholesterol and why excessive cholesterol is bad for you. So there are two types of cholesterol. Sorry. So there's two types of cholesterol. It's called lipoprotein, and the main two type is LDL and HDL. So in my next slide, I would like to know, does anybody know which one is the good cholesterol and which one is the bad cholesterol? Is it HDL or LDL? Can somebody tell me or share with me which one is the bad cholesterol? Is it LDL or HDL?
LDL.
LDL. Who is that?
Cool.
Oh, good. That's good. Yes, correct. It's LDL. Do you know why it's bad cholesterol? My apologies. My system is a bit laggy, so it doesn't show immediately.
You have translate.
Bad cholesterol because of food. Food involved with food eating. Diet. Okay.
Okay, that's good. That's good. So, that's right. So LDL. So when you receive your blood test, right, there's a few, investigation. Under the investigation is there's some names, there's triglyceride and all, which later on I will share with you. But these are the two main cholesterol which we are looking at. So the HDL and the LDL, and why they are bad and why they are good. So LDL is bad cholesterol as it will plug into, it will clog up your vessels, your blood vessels, right? So it's moved like an empty tube. So when the LDL, what it does is that it will clog up the blood vessels. So these will lead to you having a situation called atherosclerosis. So it's the clogged up of the cholesterol in the blood vessels. But HDL, it brings back the cholesterol into the liver. So that's why it's a good cholesterol. So when the more you exercise, the more you will produce HDL, which will help to bring down the cholesterol level. So if you're not very conscious in your eating habits or you don't exercise regularly, your LDL will build up, and that's when you have a high level of bad cholesterol. Hold on now. Okay, sorry. Okay, yeah, so I was sharing earlier is about this LDL and HDL. So basically HDL is the good cholesterol. So it removes the cholesterol from the blood vessels, meaning the arteries, to bring back to the liver. Your liver, I mentioned earlier that it produces cholesterol and it processes the cholesterol. But LDL is known as bad cholesterol. There, my cross. So it's because it clogged up the vessels. Your blood vessels is like, imagine it's a beautiful empty vessels, like a tube. Is empty, so the blood can flow very smoothly. So imagine the tube is clogged up with let's say you have like tissue or some rubbish. So the smooth is not very smooth. The flow of the blood or the water is not very smooth. It's like our blood vessels in our body. So it will clog up. So it will be, that's when your blood your hypertension will start to come in. Your blood vessels will be, as in your pressure of the body is higher. So that's why it's not good if you have a high level of low density lipoprotein. In short, we call it LDL. So what is high blood cholesterol level? So what does it mean? It means, like, people keep saying cholesterol, oh, high cholesterol. Then after that you hear hyperlipidemia. What is it? Is it the same? So what is it? So hyperlipidemia is when there are high levels of lipids or fatty substance in the blood. So hyper meaning high, lipidemia is actually fats. So it's a Latin term, means you combine, so it become high cholesterol. So hyperlipidemia is another term, medical term, that we use in the hospital among the doctors and the nurses to say that, oh, you are diagnosed with hyperlipidemia, meaning you have high cholesterol level. So what are the causes and the risk of high blood cholesterol? Is generally due to hereditary. Let's say your ancestors, your parents have high cholesterol level, likelihood you might also get it if you don't practice healthy lifestyle, age-related, sex, diet, particularly intake of food enriched in high cholesterol level, like high saturated fat, trans fat, or very oily food. So if you keep having it on a daily basis, you don't moderate it, then you are at risk of having high cholesterol. Obesity and overweight is also another main contributing factor, which can lead to having high cholesterol. And physical inactivity. That's why you always hear from doctors and nurses, you keep emphasizing, oh, it's important, you must be careful in your diet, choose low fat diet, low cholesterol, those oily food, try to cut down or eliminate it. Is because these will actually contribute to you having high cholesterol level, or we say it hyperlipidemia. So far so good. So what are the signs and symptoms? Maybe I would like to ask all of you, what are the signs and symptoms of high cholesterol level, high blood cholesterol level? Do you know, is there any symptoms that you think you might face, or you feel to think like, oh, I think I have high cholesterol? What makes you think, like, do you think there are actually signs and symptoms of high cholesterol level? Maybe anyone can just unmute themselves, or you can type it in the chat box. I try to periodically check.
Hi, Miss. Do you have any Chinese cholesterol? Some,
Yeah.
because a lot of seniors don't understand about English words.
Oh, I see. Okay. Today's session is in English. Next week's session will be in Mandarin. But it's okay. We can I'll try my best to use very simple English, so hopefully they can understand. So we will just continue. Maybe I think someone tried to unmute and wanted to answer. Chan, is it? You wanted to answer what are the symptoms of high blood cholesterol?
Can I answer?
Yeah, sure, go ahead.
Obesity and also feeling tired easily.
Feeling tired easily, obesity. Good try. You're quite close.
I don't think there are symptoms. Only go to doctor and check up, then know it.
Very smart, Miss Christina.
Thank you.
Good, very good. Yeah, you're very aware of. Actually, her answer is very true. So actually, it's a silent medical condition, just like hypertension. But for some hypertension cases, you might feel it. But for cholesterol, you will only know when you do a fasting blood test. So when you go to the polyclinic or any clinic, you do the blood test, the fasting blood test, then the doctor is able to see what is your cholesterol level. So what are the complications of high cholesterol level? So remember, I'm not sure whether you have heard of it, but I think generally the doctor or the nurses will always tell you, oh, you're at risk for stroke. Why? Because when the blood vessel, so imagine, you try to imagine those pipe, when your toilet pipe clog, you cannot flush. Example, a very good analogy that I can give you is your toilet bowl. Every time you use the toilet, you can flush, right? Quite smooth. Then suddenly one day you flush cannot go down. Then when you force it down, then after it will start to burst. So imagine this is in your blood vessels, especially you have the big blood vessels and you have the small blood vessels. So imagine if the blood vessels were to block by this cholesterol, then it cannot flow. That's when you start to have stroke. So if you go to the brain, you can have stroke. And then if you go to the heart, you have heart attack, you have chest pain, and then you have all these symptoms, which is very dangerous. So that's why it's very important to monitor your cholesterol level, because you are at risk for having major medical issues such as heart attack, chest pain which will eventually leads to heart attack if it's not intervened early. You can have stroke if, let's say, you have the symptoms and then you don't monitor it, you don't go for treatment, then you are at risk for having stroke. And narrowing and the hardening of the blood vessels, we should call it as peripheral artery disease. This one actually can result in having hypertension. So that's why it's very, very important for us to monitor our blood cholesterol level. We go for routine screening, so which I'm going to mention earlier. So what are those with no risk factors? So those who are healthy, you're active, you're eating healthily, so it's good to go for routine health checkup. Start going for a fasting blood test as early as 40 years old. I myself is already going for a yearly health checkup, because sometimes you might not know. It doesn't mean you must be of a certain size, you must be over fat, then meaning you're at risk, then I must go already because you're in that category. But those people who are very slim, it's possible for you to have high cholesterol level because of our diet intake. So that's why it's very important. It's good to actually check. Yeah, don't be surprised for those who are very slim and lean, we might actually have high blood cholesterol level. And if the blood test is normal, you should continue to screen it every 3 yearly or as advised by the doctor. So those who have higher risk factors, as I mentioned earlier, it's good to check with your doctor, and they will advise you on how frequent you should be screened, either 6 to 12 monthly, blood tests, and then they will monitor, they will adjust your medication accordingly. So know your target. So this is the blood test. So I'm going to go to the next slide to just show you how it will be like. So this is the normal range by the Singapore Heart Foundation. Okay, So this is very important. So now everyone is very IT savvy, right? You can log in into your health hub. You can even see your own blood test by yourself. So what you should look out for? So let's say you go for the health screening, but then nobody call you or never follow up with you. So what actually you should look out for? So it's good to know. You look at this 1, 2, 3, 4. Total cholesterol. This is the total cholesterol in your body. These are the breakdown from the total cholesterol. So just now earlier, somebody mentioned LDL. So let's look at LDL, cholesterol LDL. So these are the normal range in your health hub, right? They will show you the normal range. So the optimal range, the desirable range. So if let's say you go for health screening and nobody actually call you back, meaning it's good news. But if somebody call you to come down for appointment, meaning it's at risk lah. Yeah. So, but it's good to know. Yeah, it's good to know. So what you should look at total cholesterol. If let's say the total cholesterol is slightly high, do not panic. You straightaway go down to the breakdown of the total cholesterol. We mainly look at the LDL and the triglyceride. The HDL are the good cholesterol. So the triglyceride is the one that will lead to having diabetes or having heart attack. So we look at LDL level, whether is it within the optimal range or not, or is it out of the optimal range. Then you should be a bit worried and go and see to the you can book an appointment to see the nearest GP or go to the polyclinic to seek advice, and the doctor can review your blood test and advise you accordingly. Or you can be enrolled with us and we can advise you further. So I mean, it's good to know. So for those who have health hub and you can access to your health hub, look at the blood test, see the total cholesterol. If let's say your total cholesterol is high, do not panic. You look at the breakdown, like the HDL, the triglycerides, and the LDL. So what is it you should look at? You should mainly look at these two. Can you see I'm circling these two? Yeah, so whether is it within the optimal range or not. Okay. And if you need further advice and you feel like it's out of range but nobody seems to follow up with you, so do book an appointment with a doctor for them to advise you further to see whether you need to be started on any medication to lower down your cholesterol level. So treatments are readily available. So if the blood test is very simple, the doctor or the healthcare professional will advise you on how to manage your high cholesterol level and to follow on any complications detected. So we definitely want to prevent complications that I mentioned earlier of having chest pain, heart attack, stroke, hardening of the vessels. And if let's say the concern is, if I go have screening, then high cholesterol, then that's it lah. For my entire life, I have to be on medication. Is it true? Do you think you have to be on medication for your entire life? Is it possible for once the cholesterol level is controlled, okay, I can stop? What do you think? Do anyone know or have experienced before? Anybody want to share with me? Do you think you need to take the medication for life? And why?
The
Sorry?
chat group, they answered yes for life. Two answers, Daisy and Mei Chan.
Oh, Daisy and Michan, thank you. Okay, so yes, why do you need to take why do you need to take the medication when you get to stop it? That's why it's important for you to go for your regular checkup. For those very well controlled, it's usually every 6-12 monthly, or even better one would be every yearly. Why? It's because the doctor or the medical professional need to monitor to ensure that it's within the optimal range and it does not go higher than the normal range, so that it prevents you from all these complications. So, but remember, with the medication, it does not replace your healthy lifestyle. It doesn't mean, oh, you're on medication, that's it. You can just continue to eat unhealthy stuff because you have medication, right? You can continue to eat oily stuff. No, the doctor will prescribe you with cholesterol medicine to help you to bring down and control the cholesterol level. But you on your part, you need to ensure that you change your lifestyle by ensuring you eat healthy diet, cut down on all the trans fat, saturated fat food, cut down on oily food, start to do exercise. If let's say you have never done any exercise, start small, go for brisk walking for 10 minutes and gradually pick it up, So all these changes will help eventually bring down your cholesterol level with the medication. And if the doctor monitor and feel like, even like after they started the medication and it keeps improving until that is within the normal range already, and then they keep cutting down the dose, and they're like, maybe you have that, chance of stopping. But of course, they will assess your risk factors first before they decide. Yeah, but of course, if you have other chronic diseases and you have cholesterol, so they have to be very careful because of other risk factors that they don't want you to have. So sometimes it's very important to go for your regular follow-up so that this will prevent from other complications. So there is nothing we can do once we have blood cholesterol. So what do you think? So after you are being diagnosed, then you say, oh, alamak, your cholesterol level is so high, started medication already. Okay lah, that's it lah. Does it end there? No, it doesn't. So if let's say you are a bit on the heavy side, you can slowly start to explore and try to lose weight, meaning cutting down on healthy food. When you're looking into that kind of life choices, naturally your weight also will reduce when you start to go for exercise, simple exercise. Start small first. Yeah, so self-care is very important. So especially I think at this age, some of the elderly will share, oh, I'm very scared to go out low, I scared I will fall. Then, you can join any senior activity with, they have morning exercise, you can join. If let's say you cannot do they have exercise modification suitable for your functional needs. Let's say you cannot stand, you can sit down and do exercise. You watch TV, you can also exercise, just, lift up your leg, all these can be looked upon. So small baby steps. So exercise for those who are able is good if you can exercise 30 minutes for 5 or more days per week. So if you can do 45 minutes a day, as in one time, you can try to aim for 3 times a week. Yeah, so not more, try not to have interval of more than 2 days apart. Yeah, because of the momentum. So for those who have never exercised before, or you have fear of starting exercise or whatever reason, then start small. It's okay. Those who like shopping, you go shop. You can shop, right? You try to, instead of shopping, window shopping, you try to walk for 10 minutes first. Brisk walking at the park. Start small, then slowly you find, I can walk for 10 minutes. Then try to increase the pace because exercise helps to bring the good cholesterol. Do you still remember which one is the good cholesterol? Is it HDL or LDL? Cannot have us, but I think people will HDL. Is it LDL or HDL? Which one is the good cholesterol?
HDL.
Yes, correct. So if you exercise, the more you exercise, it will bring down your LDL and it will raise your good cholesterol. Good, right? So that's why you must try, okay?
Yes, I'm happy to hear it. Thank you.
So for those who drink and smoke, so these also will actually increase your cholesterol level. Try to cut down on the alcohol intake and try to cut down on the smoking. If it's best if you can stop entirely, but if it's not possible, cutting down do make a difference. Doesn't mean like, oh, it's just a few, doesn't matter lah, no need to change. It does. Start with small changes. And is this considered Is this considered healthy diet for people with high blood cholesterol level? So I need to close this. Cannot see. Okay. So healthy diet. Is this considered healthy diet for people with high blood cholesterol? So like I mentioned earlier, diet-wise is very important. Medication alone does not help. So I can nag you all day, take your medicine, but you continue to go eat char kway teow every day, you continue to eat oily stuff every day, deep fried food stuff, food with trans fat, baking stuff also, baking goods also have high in trans fat and saturated fats. You continue with that kind of unhealthy diet, medication alone is not enough, and you must wonder like why the doctor keep adjusting the medication from simvastatin, then upgraded to lovastatin, upgraded to atorvastatin, then the dose keep going up. Is because medication alone is not enough. It needs to be a twin combination, which is you need medication, you need a healthy plate diet by a health promotion board, and you need exercise. Yeah, so you cannot go down to exercise. It's okay, exercise at home. There's so many ways for you to exercise. So if you need any advice for the exercise, you can approach any of the community nurses. So we can advise you further. So healthy plate, what are we looking at? Healthy plate. So we are looking at less fat. Eat less fat, eat high cholesterol, eat less high cholesterol food, and eat more fiber. So there are healthy cholesterol foods such as avocados, eat meat. Let's say if you eat meat, try to remove the skin. Yeah, try to cut down on processed food. Those who are already diagnosed with high cholesterol level, do not eat egg yolk more than 3 times a week. You can obtain for more fiber, high fiber intake, eat more vegetable, cheese, yogurt, those healthy cholesterol food, and avoid those unhealthy cholesterol food. So there's different kind of low fat diet tips that I can share with you. What is trans fat, saturated fat, and unsaturated fat? So among these 3 categories, unsaturated fat is the healthier saturated fats. That's why we always advocate go for olive oil, go for vegetable oil, any vegetable oil, go for sunflower oil, avocado, nuts. They are healthy form of cholesterol. I would say, sorry, healthy form of fats. But trans fat are usually in fast food, baking items like cakes, pastries, chocolate. Yeah, so deep fried food. So these are the categories that this one we need to avoid. Cut down doesn't mean totally the nurse say this one cannot, that one everything also cannot. It's not cannot, you can cut down. Yeah, eat in moderation. Yeah, so maybe let's say for example in a week you have that every day also I eat nasi lemak, every day also I must have my char kway teow, then cut down. If you cannot have it every day, you have it maybe you try for a start 4 times a week, then slowly cut down 3 times a week, and then cut down once a week. Yeah, it does make a difference to your cholesterol level. You don't believe, you try. Then you let me know. And then saturated fats would be vegetable fats from coconut oil, palm oil, kernels also, creamer, condensed milk. So these are vegetable fats, which some of you might not realize. So it's good to cut down, okay? And then animal fats like the skin, the chicken skin, the fatty meat, the fats, the ghee, full cream diet, you can have it, but try to cut down on it. But if you want to eat the meat, best is to remove the fats. Okay. So I've come to the end of my health talk. I'm so sorry, probably not all is aware that the health talk is held in English today, but next week you can still join us for our health talk, the same topic, but it's in Mandarin. So if you're interested to find out more about exercise, about diet, how you want the nurse to advise you further to manage your high cholesterol level, you can email us or you can give my department a call, or you can approach any of us, maybe Radin Mas also. You can just type down to find out. Take a picture of this. I will leave this for a while for you to have a look. You can email to us to get enrolled with us for us to advise you further on how to manage your cholesterol. So only within this catchment area, Teluk Blangah, Chinatown, Katong, Bukit Merah, and Tiong Bahru. So with that, thank you. I'm open to any questions pertaining to this topic. I have some of my colleagues on the ground who will help me to support in answering your questions. Feel free to either type in the chat box or you can just unmute yourself.
Hi, sorry, I forgot that the timing is 2 o'clock. I turn on at 2:30. Can you just show a very brief, your slide? I just have a glance at it so that I just, see the headers, Can? Thank you.
I think you can, this is on Facebook Live. If I'm not wrong, there will be, you can view it back on Radin Mas Facebook. Wait, let me try to stop share and share again.
Okay, second page. Okay.
So anybody else have any questions?
Sorry, can you just the page 2 or page 3, like, just at each page you give me about 2 minutes. I glance at it, you can turn on, Can? Thanks.
Hi, I think there's a question pertaining to I think a question by Nancy. She's actually asking whether cholesterol pill can be cut down or cut off, and how and when to determine whether this is the right time for this. Yeah, I think earlier on Nadia did share a little bit about this. As for cholesterol pill, right? Normally once you're started on this, the doctors will actually give you regular follow-up to take blood and then to monitor your cholesterol level. As on when to cut it off and when is the right time for it, it will also be determined during your regular follow-up after your blood test with the doctor. Yeah, so Nancy, I hope this answers your question.
Okay, I saw, thank you, Pinyin. I saw some questions by Irene. If the liver produces 80% of the cholesterol, controlling food wouldn't help much. And then Eleanor mentioned that heard that as we age, cholesterol will build up even if we try to, by taking healthier choice of food. Is it true? And are statin safe? Okay, I will answer some of the questions and some of the other questions my colleague will help to answer. Okay, as you age, cholesterol will build up even if you try taking healthier choice of food. Is it true? Not necessary. So if let's say you lead a normal sedentary lifestyle, then definitely it will build up. If let's say you're not exercising, you eat unhealthy food, then definitely it will build up over time. But if let's say as you age, you are in control of your dietary intake, you eat in moderation, you are physically active, then it will maintain or it will be even better. And are statins safe? Yes, it is. That's why most of our patients who have high cholesterol, they are on statins. But definitely for some of them on long term, they might have the side effect of statins. That's why they go for regular checkup for the doctor to take their blood test. So when they initially started on statins, the doctor will actually do a blood test to check on their liver, the liver function, whether is it improving or is it deteriorating. So definitely blood tests are done quite regularly at the start and then periodically to monitor every 6 or 12 monthly until they are stable enough. So I hope that answers your question. Maybe for Irene, you also asked about, okay, most of the cholesterol are produced by the liver, but controlling food won't help much. No, that's not true. So research papers have shown that by controlling, actually the cholesterol that produced by the liver for varying reasons. So mainly for cholesterol production at night by the liver is to help with they do process the breakdown of cholesterol, and also they process good cholesterol. So the bad cholesterol mainly comes from our food. So by controlling your diet, eventually it will actually control your bad cholesterol level. I hope that answers your question. So what is the cholesterol level before the doctor prescribed the medication? So depending on your age and the level of your cholesterol, the total cholesterol, meaning the doctor will look at the LDL and triglyceride, then they will decide. If let's say you're on the younger range, probably they'll ask you to start exercise, control your diet. But if you're already at a certain age and they feel that they will look into your risk factor definitely, whether you have chronic disease or you're still healthy, you're physically active. They will have to assess you as a whole, not just like your level. They just look at they look at a lot of things, whether your age, your risk factors, are you at risk, and then whether you're physically active. Yeah, so based on this and the levels that they have, then they will advise you further. Because if BMI is high, then it's best to continue. That's right, definitely. So do not suddenly stop your cholesterol level. Why? It's because even though you feel, especially for those, I do understand, I do have patients who actually, they are very concerned by, they are on this medication very long and they are well, they feel they are well, so they just stop. So remember that the doctor will assess you every 6 to 12 months, depending on your condition, definitely. So they will assess your risk factors also. So if you stop suddenly, you might not know, maybe you have other conditions that contribute to your cholesterol level. So that's why it's very important. Discuss with your doctor about your condition and about your concern. They will advise you further. Just one long-term cholesterol pill can cause muscle pain, especially in the calf. How can we relieve the pain? Okay, from my team, anyone want to take up this question? So you're talking about the side effect rhabdomyolysis, right?
You're saying that the statin will cause you muscle pain long term. If let's say it causes you to have muscle pain, then it's better that you tell your doctor that you have muscle pain, then they will check your blood, whether you have any the adverse reaction from the cholesterol that you're the statins that you're taking lah. So if let's say the muscle pain is caused by the statins, then they may change to another type of statin. But sometimes the muscle pain can be caused by over exercise or something. So that one, it will be relief lah after you have rest. Yeah. So it's important to check with your doctor and inform your doctor if you have muscle pain or feeling very tired after you started on statins. But tell them your symptoms, then they will check your bloods to see whether your enzyme, your muscle enzyme is raised lah. Does that answer your question?
May I ask you, people can go to polyclinic to check up their cholesterol level. Is it so?
Yes, polyclinic is one of the places that you can check your cholesterol. That's correct. Yeah, you also can check with, depends on the doctor that's following up on your what condition that you have lah. Whether it's your hypertension, diabetes, your cholesterol, you know, the kind of thing. Even the heart doctor also, they also will regularly check. So depends whether you have a primary doctor that's following you up on chronic conditions.
Okay, thank you very much.
I saw one question. Irene asks, liver produces mostly good cholesterol. Eating oats will lower cholesterol. Eating oats alone will not lower your cholesterol, but it will not increase your bad cholesterol. It's a healthy diet. So, like I said, I mentioned many times and I emphasize the 3 things that you need to look out for if you want to bring down your cholesterol level, which is being compliant to your medication and exercise and healthy diet. Yeah. Doesn't mean you have to stop everything, no, but taking it in moderation, it helps. So for a start, if let's say you find that it's very challenging, you're so used to this kind of like this kind of sedentary lifestyle, start small. You know, find something that you know that you can do and it is sustainable for you to last it for a long time. So instead of cutting like it entirely, you can start by eliminating it one by one. So it doesn't feel so heavy and so difficult. Any other questions?
The liver produce good or bad cholesterol? I think this one will get back to you on that. To be honest, I really don't know whether they produce bad cholesterol or not. Maybe they do. So maybe it does. So we will get back to you on that. Sorry. Yeah.
Do you think bee hoon is cholesterol good food?
Sorry, can you
Sorry?
repeat your question again?
Yeah.
If you have bee hoon for meal, like fried bee hoon, not so oily, is it good diet?
If you make a comparison between yellow noodles and white noodles, then that is of a low calorie. So it depends on the comparison. So if you're asking me about whether it's good or not, I wouldn't say fried bee hoon, if you cook it with olive oil or canola oil, then it's fine. But if you cook it with maybe coconut oil or those saturated oil or trans fat, or you put unhealthy ingredients, then probably I don't advocate for it. Yeah, so it depends on what you cook and how you cook it. Yeah, but definitely bee hoon is better than yellow noodle.
I think you have to see whether the bee hoon they fry with a lot of oil or a little oil. If it's a lot of oil, I suggest that you go for, you know, bee hoon soup instead. Yeah. Sorry,
For
just
the
now about the
question-
liver thing. Okay, so basically the liver produces cholesterol, and it also helps to breaks down cholesterol lah. So basically, if the liver is healthy, you don't try to overtax it lah. If let's say we eat moderate amount of cholesterol or fatty food, that kind of thing, so the liver will be able to manage it lah. So if let's say it's a high, very fatty or what, or high cholesterol food, then the liver will be taxed also lah. So we hope that by controlling our diet, then the liver will be able to manage the cholesterol in our body lah, in a healthy way. I hope that answers the question.
If you take more vegetable, less meat, does it helps in your cholesterol?
Yeah, the cholesterol, how to say, it helps to in the intestine. If let's say you have fiber and all that, right, it helps to bring down the cholesterol lah. Yeah, the absorption of cholesterol from your intestine as well. Yeah, so it does help lah. If you take more vegetables, yeah, the fiber in the intestine will help.
What about nowadays they have this what do you call it, sandwich, they call it like the sandwich wrap. What is that, a good diet than eating rice and all that? What do you call it, wrap sandwich?
The sandwich, right? If let's say the sandwich is it depends on the dressing also. Sometimes they put a lot of mayonnaise dressing, that kind of thing. Mayonnaise is made from oil and eggs, so the dressing should be reduced lah, if those type of oily dressing. If let's say you choose either you use less dressing, or you can choose less oily dressing lah. Yeah, but also cannot be too sweet also, because it will cause all this in the end turn to fat, right? Yeah, so moral of the story is reduce the dressing, not to add too much dressing.
I see. So you say mayonnaise is not good sauce? You mean mayonnaise is not good sauce?
Yes. If you read the content of mayo, it's mainly eggs. Yeah, with a lot of So you can have the mayonnaise, but not in large quantities. So we have to wrap up for the session. Any last question? I'll take in one last question before we end the session for today.
It seems like it's better for us to cook for our own meal, right? Since we cannot.
Definitely. Because you know what's inside your food. But of course, for those who are not able to or can't, then you try to look for the healthier choice logo, or you can try to, you observe, try to find those less oily food, or those they boil or steam. Try to opt for a less oily or high cholesterol diet. Yeah, I understand it can be quite challenging when you eat out, but choose wisely and eat in moderation.
Okay, thank you very much for the talk.
I hope
Yes.
Thank you so much. I hope we answer most of the questions. For those who still have burning questions and you're not able to ask those, you can always email us, and we try our best at pico1@sgh.com.sg. We try our best to answer all your queries. Yeah, so with that, we end the session for today. Next week, we have the same topic in English. So if for those who miss or entered halfway, you can join us next week for the same topic at 2:00.
Sorry, just now I was occupied. Nadia, there's one more, the butter or margarine. Someone asked wrote in the chat. So the basically butter, we don't suggest the butter because it's saturated lah. Margarine is also those what do you call it? We will prefer that if you can, you try and use olive oil or those monosaturated or polysaturated fat lah. Yeah. So reduce your butter and margarine lah. Yeah. Not to say cannot, but then reduce it. Okay. That's all.
What about garlic butter?
Garlic butter also butter, right? So reduce it lor.
Thank you.
Okay. Okay, thank you very much. Yeah. So Nadia.
Okay, with that we end the session. Thank you everyone for your undivided attention. I hope it's a fruitful session for today. So I'll see you again. And we end for the session today. Bye-bye. Thank you.
Thank
Have a
you.
good rest,
Thank
everyone.
Thank you, everyone.
Thank you.
Bye-bye.
Bye-bye.
Bye.